everyone.
Hi.
Hello.
By show of hands, how many people know what a vaccine is? Great. How many people like getting vaccines? I don't like getting vaccines either. And everyone at some point in their lifetime has received a vaccine and did not like it. How many people know how to give a vaccine? It's okay if you don't know how to give a vaccine because that requires special training and a certification. My name is Latoya and I've been a medical assistant for 17 years. I graduated from a medical assistant program in 2002. I learned basic aseptic techniques, phlebotomy, and administering injections, including vaccines. I've given thousands of vaccines and injections over the years. I've also done research on types of vaccines, routes for administration, and proper techniques. Learning to administer vaccines properly can decrease infection and injury to the patient and the healthcare provider. Today, I will tell you first, the types of vaccines, second, routes of administering vaccines, and third, how to properly give vaccines. Vaccines are given from 0 to old age, and the types vary depending on age and immunity. The U.S. Department of Health and Human Services on their website this year stated, based on a number of factors, scientists decide which types of vaccines they will make. There are 4 main types. The first is live attenuated vaccines, which is made from a weakened form of the germ, and they prevent measles, mumps, rubella, rotavirus, smallpox, chickenpox, and yellow fever. The second are subunit recombinant polysaccharide conjugate vaccines, which are made from specific parts of the germ to prevent the disease. They prevent Hib or Haemophilus B influenza, hepatitis B, HPV or human papillomavirus, the whooping cough, pneumococcal, meningococcal, and shingles. Inactivated vaccines are made from a form of the germ that is no longer living, and they prevent hepatitis A, influenza by injection, polio by injection, and rabies. The last are toxoid vaccines. They are made from toxins created by the germ to prevent the disease. And the diseases they prevent are diphtheria and tetanus. Children and adults have a schedule for vaccine administration. Parents sometimes object to vaccinating their children, but recommendations for the children's vaccines by the CDC stated, on-time vaccination throughout childhood is essential because it helps provide immunity before children are exposed to potentially life-threatening diseases. Adults often think that vaccines are only for children, but that is not true. According to the CDC website, updated 11/21/19, protection from some childhood vaccines can wear off over time. Adults may also be at risk for vaccine-preventable diseases due to their age, lifestyle, travel, job, or health conditions. We now know 4 types of vaccines and who should receive them. Let's move on to the routes for administering vaccines. The route you choose for administering vaccines will rely on specific instructions provided by the manufacturer. There are 5 routes for administering vaccines according to the CDC. The most common delivery of vaccines is by injection. There are 3 types of injections. The first is intradermal route, into the superficial layers of the skin. The second is intramuscular route, which is into the muscle, usually the thigh, deltoid, and gluteal muscle. The third is subcutaneous route and is injected into the fatty connective tissue beneath the skin, usually the tricep and the thigh area. Other routes are intranasal, which is into the nose and does not require a needle, and also oral vaccines, which are given by mouth in liquid form and ingested by the patient. Now that we have covered the routes for administering vaccines, let's move on to how to properly administer vaccines. Administering vaccines safely protects the patient and healthcare provider from potential risk of infection and injury. Vaccines are ordered and they are administered by the clinical staff. These steps should be followed once the order has been placed. Make sure to verify the patient's name and date of birth. Then review their record to make sure the vaccines are actually due. Select the correct vaccine and dose by reading the label and cross-check with the order. Label will specify the route for administration, so keep in mind the patient's age for selecting needle size, syringe, and route. Wash your hands, put on gloves, and remove the stopper from the pre-filled syringe. Place the new needle onto the pre-filled syringe. If you have a vial, you're going to remove the cap from the vial, wipe the top of the rubber with an alcohol swab, and draw the dose with a blunt-filled needle. That will help prevent puncture to the skin while drawing. Discard the needle and place a new needle for injection. The most important step in administering vaccines is to verify the name and date of birth of the patient and the medication that they will receive. Make sure that the patient is sitting. If it is a child, have the parent assist with holding them firmly in place. Make sure that the area for injection is clear of clothing, and if it is going into the mouth, that there are no objects in the mouth, such as gum. Wash your hands, put on gloves, locate the route for administration, and if the injection area needs to be cleaned, wipe it with an alcohol swab and make sure that it is dry. Remove the cap from the needle, insert the needle at the correct angle. If it is oral or nasal, and empty the entire contents of the liquid into the nose or mouth. Then remove the needle and place the lock on the needle. Dispose of the sharp into the proper container. Wipe the blood if there is any visible and place a Band-Aid on the arm or leg. Discard all garbage, remove your gloves, and wash your hands. Making sure that the patient does not have an immediate reaction to the vaccine is the next step. Ask the patient to remain seated for 5 minutes and give them a vaccine information sheet so that they can go over the description of the vaccine that they received and common and adverse side effects to the medication. After 5 minutes, check the patient for symptoms of dizziness or rash at injection site. The patient may leave if they do not have any symptoms. Instruct them to call the facility if they experience any adverse reactions or have any concerns. To sum it up, administering vaccines with the proper technique will create a positive environment for the patient and the healthcare provider. First, I discussed the 4 types of vaccines created to prevent disease and who should receive them. Then I discussed the 5 routes for administering vaccines. Finally, I discussed the proper techniques for administering vaccines and the steps to follow after injection. Learning and understanding the importance of how to administer vaccines properly can decrease infection and injury to the patient and healthcare provider. In closing, I will leave you with this. Patients do not like receiving vaccines, but most understand the importance of being vaccinated. Healthcare providers understand the importance of vaccines and strive to make the experience of administering vaccines as painless as possible. Proper administration of vaccines by the healthcare provider and the cooperation of the patient makes this process easier. Thank you.